Hello, I'm David. I'm a recently qualified social worker and I currently work for the Crisis Resolution Home Treatment team in Lincoln. I chose social work because I'd been working in mental health in a number of different roles for quite a few years. So I'd worked for a charity down in London called Think Mental Illness, advising people on mental health and how they can get support and care, and it's something that I wanted to take further in my career. I felt I'd reached my ceiling where I was in my current role. I'd also done a few things such as debt advice and benefits casework before, and I knew the barriers that people with mental illness face to accessing care and support and treatment, and I really wanted to find a career where I could help people to live more independently and lead better lives. Well, social work is a very varied profession. It can have an impact in lots of different ways. The thing about social work is we work in a person-centred and holistic way to help people, so we can respond to their needs, their aspirations and their desires about how they want to live, to put things in place in order to help them be more empowered to live more independently. So social workers are, I think, in a unique position to be able to help people and for them to move forward, perhaps more so than almost any other profession. It's that I think is really challenging but really beneficial to our service users and patients. Well, Think Ahead training involves an academic side where you are learning about important theories, legal structures, models and approaches. Combine that with on-the-job experience, so you are doing the job but at an academic side as well. So I think it's very good that you get both the opportunity to learn about the theories that underpin work with people and that have been shown to be important in sort of how people develop, how people see themselves and their place in the world, but also put that into practice directly in the community with people and groups within society. So it gives you a really good opportunity to actually work hard and study at the same time, and I think that benefits both sides of the approach to the work. I definitely recommend this to future people. I really love the training and I'm glad and proud to be a social worker now. I think anybody looking for a career change where you are actually working with people in the community, developing yourself but also helping people to lead better lives, there's nothing, there is no better career really. You've got a lot of autonomy, you have this dynamic and flexible approach that you have to use in order to actually help people to move forward and lead better lives. And social work is fantastic if you are a person-centred person and really want to work hard to improve the lives of people that you work with and that you live with in the community. Well, my hope for the years going forward for me, I'm currently working in the crisis team, which I really enjoy. I personally enjoy working with people who are perhaps more face more barriers and more severe illnesses than others. What I like to do is to put my efforts towards helping those most in need, and I think that the crisis team is a perfect place to do that, where we are working with people who for whatever reasons are very ill or disadvantaged at the moment. I'm hoping to continue that work going forward in the Trust, perhaps work in a approved mental health professional role, maybe a forensic role going forward. The good thing about working for LPFT is there's lots of training, lots of opportunities to develop and apply your skills in different areas, but also make a difference to different people and different communities in different ways. At the moment, I'd like to work within, I think, severe psychiatric or a forensic role, but I have the opportunity of working in so many different roles moving forward that I can really use my skills in different ways at different times to benefit more people.